Hey everyone, welcome. My name is Dr. Tom. I am a plastic surgeon at Peachtree Plastic Surgery here in Atlanta. Today I wanted to do a little bit of Reddit today with you guys, if that's okay. A little while ago, I'm Dr. Tom PS is my Reddit handle. A little while ago I had a little segment. I said, ask a plastic surgeon anything. And so I wanted to kind of talk a little bit about some of the questions I got and maybe elaborate a little bit more on the answers. So the first question I got was, what are some cool new procedures or products coming down the pipeline in the next 10 years? I know fat transfer is a huge one right now. So there are some cool things coming down the pipeline. What's really hot and really popular now is fat transfer. So if you don't know what fat transfer is, it's basically the second half of liposuction. So liposuction's been around for a long time. You use a big metal cannula, some suction, we take the fat and suck it out. What we kind of realized over the last 20, 30 years is that you can use that fat to do things. You can put it back, make shapes, volumes. You can, most recently, put it in the butt to make the butt nice and big or a different shape. And that's huge right now. What we're also learning about fat is it has kind of regenerative properties, like stem cells kind of thing, that we believe there is some stem cells in fat that have rejuvenating properties. So we are now putting it underneath scars, and they can soften and raise the scar and then help with some redness sometimes. For patients that have cancer and need radiation, there's a lot of cool things that we're doing with fat nowadays that is pretty new. Other things kind of coming down the pipe. There's a lot of devices. The device segment in plastic surgery, it's hot, and all these cool things. Most of them, like skin tightening devices or microneedling is big now. They all help with skin texture, and they're all okay, but there's nothing really revolutionary out there, despite what every manufacturer would tell you, because their device is, of course, revolutionary. Other things coming down the pipe in the long term, stem cells are going to be a big thing one day. There was early research in scarless healing using stem cells. That's probably 20 to 30 years away from being commercialized, if at all ever. But those are kind of the long-term things that are coming down the pipe for plastic surgery. And then, of course, there's going to be new breast implants that are come out by different companies, that we will continue to evolve, gradual evolutions of our implant-based devices. We'll figure out how to make fat grafting better and safer, and those kind of incremental steps. That usually occurs as well. So the next question is, have I ever needed to make an executive decision and refuse and or dissuade a patient from having a certain procedure done? Yeah, a lot. I worked with a surgeon before. He's a neurosurgeon, and he said, Tom, I can teach a monkey to do surgery. I'm looking at him, he's a neurosurgeon, right? He does really complicated stuff. I was thinking, like, I don't think you could. But he's like, no, I can teach a monkey to do this procedure. That's not what makes a surgeon a surgeon. What a surgeon does is knows when not to operate. And that was pretty profound. A lot of patients will come for plastic surgery, particularly cosmetic surgery, where they come and they'll say, I don't like my face, or I don't like my nose, or my eyes look funny and I don't know why. And those patients sometimes they have an obvious problem and they just can't name it, but a lot of times they don't. And those are kind of red flag patients. And in our training, we're taught to identify these red flags, these things that are predictors that we're not going to be able to make somebody happy afterwards. And that's when we need to say no beforehand. It saves the patient a lot of grief, because then they spend a lot of money and undergo a procedure they didn't need, and they're still not happy at the end. And it saves us a lot of grief too, because we're not out to just take people's money. We're trying to make people better. We're doctors. We really are trying to improve people's lives. Next question. What do you recommend for the best non-invasive anti-aging treatments? So there's a lot of hot anti-aging treatments. I could talk about anti-aging. That's, as a term, it's like it's kind of a bad term. Really what we should say is aging gracefully, or what I tell people is I like to make you look as good as you can for your age or at your age. I can never make a 50-year-old look like a 20-year-old, but I can make a 50-year-old look like a much better 50-year-old. But the best anti-aging treatment, honestly, mineral sunscreen. Doesn't have to be expensive. Any sunscreen with zinc dioxide or titanium dioxide in it as the active ingredients, wear it every day you go out in the sun. If you do that starting in your teens and go on through life, you will be leaps and bounds above most people to prevent aging. It just is what it is. Mineral sunscreen can be cheap, it doesn't matter. I wish everyone did that. And then when you get older and your skin will still age and things, you'll still have laxity, maybe you want a facelift, then I have wonderful skin to work with. It's great. You'll get a much better result. I get really excited about sunscreen, which is really silly. The next one, what do I think of PDO threads? PDO threads, so I don't do threading because I just do surgery instead. PDO threads are great for certain people if they're done well. The problem with PDO threads is you don't really know who's doing it a lot of times, or how much experience they have doing it, or if they really know what an aesthetically ideal face is. That's the thing. And I've seen a lot of disasters with threads, and when they go wrong, it's really bad. Having a misplaced or an extruding PDO thread through your skin is a disaster. It's horrible. And that does happen. But PDO threads can look really good too when they're well done. I've talked to many people who are just super happy with their threads. Do I recommend it? No, I would. If you need a thread, you probably need a facelift. I would just save up and get the permanent surgical solution that's going to give you the best result. But I'm a surgeon, so yeah, you get that answer. When you meet people, do you ever notice something about someone that you've seen a lot of people come in to change? When someone comes to me or I see somebody out in public, I don't critically evaluate their face. I don't say, oh, that person has a polybeak deformity or jowling or could use a facelift. They're just, that person is a person, or that person could use breast implants, or that person has breast implants. I don't really think like that. I'm not at work, Now, if they come up to me and ask me, hey, I know you're a plastic surgeon, what do you think of my face? I could then rattle off all the problems I see with their face. You got some minor, mild rhytids here, some crow's feet, some bunny lines, you have a little jowling, your lips are a little deflated, could use but unless somebody asks me, I'm not going to go tell them that. And I don't even notice it unless they ask me to look for it, because that's not really nice to do. The other thing is, when people come to a plastic surgeon, they come to you with a problem. They come to you saying, my eyes look droopy or I look tired all the time. Well, that means I should address their eyes. And if I happen to notice their nose is crooked to the side, they're not here for the nose. They're here for their eyes. And I wouldn't even mention it. Because it doesn't bother them, then it doesn't bother me. It's great. And that's kind of the way it should be, I think. The best treatment for jowls: injections, thread lifts, facial exercise, or just facelifts. So if you have jowls, you probably should just get a facelift. But I'm a surgeon. That's what I'm going to say. But the reality of it is, there's lots of non-surgical ways to treat jowling. I know people put Kybella in jowls, which is this fat-dissolving injections. People do non-surgical skin tightening. We do that too. Using ultrasound or radio frequency, you can heat the skin and it tightens up. But you're never going to get a surgical result. Now, for some people who just have really mild jowls, yeah, maybe some non-surgical skin tightening would be great. You can kind of delay a facelift or make it so you don't need one for a little while longer. But there's nothing that compares to a surgical facelift. I mean, we just haven't invented it yet. Hopefully one day it'd be great to not have scars, to have a scarless real facelift. But there's nothing that's going to fix that more than a facelift. Another question: was there ever a time you did a procedure and were nervous the patient might not like the outcome? I'm kind of always nervous about that, but I think that's just me. It's not really a lack of experience. I really want to make people happy. I really want to do it right, and I'm kind of a perfectionist. And the problem is, people are not perfect, and I'm not perfect, and healing isn't perfect, and so I'm a little worrier. I get really good results most of the time, and obviously you're never going to make everybody happy, but if you do it safely and you're well trained, you're going to get good results. I just worry. It's just my personality of being a perfectionist. And I'm always critically looking at what I'm doing and critically looking at my results and thinking, how could I have done that better? Or I'll notice something on a result that's not perfect, and the patient never will, but I will. And I don't point it out to them, because then that's all they'll see, and they're happy with their results, so why make them unhappy with it? But I'll notice it and I'll think, how could I have done that better? I think the last question today is going to be, what's your favorite type of procedure to do? And why did you decide to go into plastic surgery? So I'll be honest with you, my favorite procedure to do is a breast augmentation. Simple breast augmentation on a young girl who is unsatisfied with the size of her breasts. Why? Because it's really easy. Not technically, it's easy to make somebody happy. 98% satisfaction with the primary breast augmentation. It's a great procedure, and it completely changes people's lives too. I can't tell you how many times I've done a breast augmentation and the patients come back 2 weeks later and they're crying because they're so happy, and they say, people notice me now, and I have so much more confidence. The reality is people may notice them more, but they're probably just more confident in themselves, and then they feel like people are noticing them more, which is equally good. That's still a really good reaction. It's a really cool feeling, and it's really similar to like curing somebody of disease. Not that having small breasts is a disease, but like that same feeling of happiness and joy that you've fixed something in their life, or you made their life better. I love that. Why did I decide to go into plastic surgery? Kind of a long story about how I got here. Didn't always want to be a plastic surgeon. Actually, I was a fireman before ever going to med school. And then when I was in paramedic school for part of my fire training, and that's when I kind of realized I actually like medicine way more than firefighting. That's for the brave, and it's very scary at times. It was cool, but yeah, I leave that for people way more brave than me. But I was very creative, and I found that I really liked healing medicine. When I went to medical school, I kind of knew I was going to be a surgeon. I liked doing things with my hands. I had to be constantly tinkering with stuff. And I knew I was pretty creative. I used to make taillights for Japanese cars. That was kind of a business I had in med school. I really would go out into my shop and work on circuits. I would fix things and build things. So you kind of know whether you're a surgeon or a medicine doctor in med school. And plastic surgery was the field that was the most creative and kind of fit my personality the best, I think. I really enjoy what I do. If I had to do it again, there's no way I would go into any other field. I don't think I'd be happy doing anything else. So it's a cool field. Anyway, guys, this is my first video. I hope to do more of these. I hope somebody watches it and likes it. I hope it's helped some people. It was nice to meet you guys. Talk to you guys again. Please, if this ends up on YouTube, I'm supposed to say, subscribe and hit the like button or something? I don't know. I just hope it helps somebody. All right, cool. Take care.